So I'm going to introduce Michaela now. Michaela is a great friend of HIROC. Her and her team are doing awesome things at the Ottawa Hospital, and we always look to them actually for inspiration. Michaela is a communications professional, sports writer, and radio show host in Ottawa. She works in media relations officer for the Ottawa Hospital. You can hear her Extra Hot Tea Sports Takes on TSN 1200, where she hosts a weekly show called That's What She Said, and various other shows on the network. She hosts a podcast and where she talks about her favorite team, the Red Blacks. And she's a proud graduate of the Humber College Postgraduate Public Relations Program. Michaela is passionate about storytelling, search engine optimization, and connecting businesses to their target audiences. She believes that a well-crafted story can accomplish anything, and that nothing beats the right playlist and a strong cup of coffee. So without further ado, welcome, Michaela.
Thank you, Philip. Quite the introduction. I feel like I should have had a cup of coffee on hand right now, and unfortunately I don't. I'm ill prepared.
Well, I want to get some bubbly water. That's not an outcome. Well, we'll get right into it. This session's gonna be a bit informal. We're gonna have like a fireside chat, and we may pop up a slide once in a while so that you guys can take any main takeaways from Michaela's thoughts down. Of course, again, like I said, if you have any questions, just drop them in the chat box anytime. So, Michaela, can you share your top 3 tips for working with the media?
Yeah, so I feel like, given that this is a communications conference, I'm sure people watching are well versed in the kind of basics of working with media. Do your research, know your audience, make sure you know what the media members you're dealing with are writing about or talking about in whatever platform they use. But I wanted to kind of focus a little bit on some of the things in healthcare media relations that I've learned over the last couple of years with the Ottawa Hospital. So number one, and I think this goes without saying, and I'm sure I'm not saying anything new, is building good relationships with media. And this doesn't mean that you're necessarily best friends with them, because they have goals, you have goals, and sometimes those goals don't align. But at least having honest and open relationships with them, where they trust you and you trust them, goes a long way. And building these relationships in good times will really get you a long way in the not so good times, when you maybe need each other a little bit. You can have those honest conversations. Sometimes in healthcare, we're often stuck in a bit of a tricky situation because there are a lot of things that we can't say. We're bound by patient confidentiality. We're bound by certain government regulations, and we're not always able to give the information that the media are looking for. But if they trust you and you have a good relationship with them, you can kind of explain this, and you can make sure that your message is still getting across without the media thinking that you're hiding anything from them. So number one would be relationship building. And part of that is kind of my second point, which would be, be honest about what you can get them and what you can't get them. And this really does contribute to building relationships. But oftentimes, if they're looking for an interview with someone, maybe just because of availability, doctors are often busy, you might not be able to get them an interview. Or maybe because your hospital isn't necessarily in the best position to speak to this, you can't get them an interview. But you want to give them some information, so you'll provide a statement. Be honest as early as possible about what you're actually going to get them or what you can't get them, so that they're not expecting, to have someone in an interview and you send back a written statement, which is not often what the media want. But if you help manage expectations a little bit, they'll often be a little more understanding with whatever you are able to provide. And the third thing is, this more applies to, times of crisis, is make it as easy as possible for the media to get the information they need. So if we're looking at, a community crisis, where, I'll use like a big car accident where there's multiple patients, and it is of public interest for the hospital to keep the public informed on, the number of patients they've received, provided there's no patient confidentiality breached, and their various conditions. That's what the media are going to be asking for. If you can make it as easy as possible for them to get that information in a timely manner, I think that makes everyone's life a lot easier. And what we've turned to do in times like this is use our Twitter feed for our news feed. So we'll ask everybody to don't post on our Twitter feed all of, from now forward, all of the information on Twitter is going to be related to this incident and any of the public information that the public needs to know. And this, it might not be just related to the number of patients we receive. Maybe there's a safety issue that we need to communicate with the public. If the media know where to look for that, if they know to look to your Twitter account for continuous updates in times of crisis or big news stories, it makes their job a lot easier. And then it makes your job a lot easier too, because instead of answering 20 media requests, you're sending out one tweet and covering your bases. So those would be my 3 main tips.
No, that's great. I'm going to show this slide here so that people can see it. Just trying to get this right here. So like Michaela said, we talked about relationships. I'm just moving our faces around. Honesty and information. If you wanted to jot those items down, it's great. So my next question to you, Michaela, is in your opinion, what's one key element communication teams should keep in mind when collaborating with partner organizations such as public health, neighboring healthcare organizations?
Yeah, so this has been a big one, especially for this year, given that, for those of you who don't know, we're in a global pandemic, and the collaboration of healthcare organizations in various areas has become incredibly important now more than ever. And some of the smaller kind of logistical and tactical things we did was, we set up a regular standing meeting as often as needed. In busy times, it was as often as every day. When things got a little more manageable, it was maybe once a week or once every 2 weeks. But having that standing meeting where everyone is going to be in one place at one time, and you can just ask each other, what do you have going on? What can we help with? What that you've done can be of use to us. And just a general space to kind of share what everyone's working on, the problems everyone's facing, any kind of news that might be coming out of anybody's organization. Just having that standing meeting, not just in times of a global pandemic, but I think always, like if 2020 had been a normal year, it would have been good for us to have maybe even a monthly or bi-weekly meeting where all of these organizations, comms folks are just getting together for a short period of time to just bounce ideas off each other. And you never know what's going to come out of something like that. But that's more tactical and very specific, but something at more of a high level, I would recommend, and something we've kind of learned this year is, each organization is going to have different goals, and it's important to understand your goals going into this collaboration and their goals and how they differ, but also where the common ground is. Even 2 hospitals can have very different goals at a specific time from a communication standpoint for a variety of reasons. Understanding that, okay, there are going to be times where it makes sense for us to collaborate on this, announcement. Maybe we do a regional announcement instead of individual hospitals, but there are times where that doesn't make sense. And we have a different set of rules here. We have different goals for this. So we're going to do our own announcement, and other healthcare organizations can do something different. But just understanding that common ground between our goals can help identify areas where collaboration is possible, save everyone a little bit of work and make everyone feel a little less lonely. But then also understanding that, hey, it's not always going to work out. But those open lines of communication on a regular basis are where you're really going to find that.
And it flashed up the screen of what the common ground is very important. The next, and Abby actually added in a point, and this has been a kind of a recurring theme, is that regional meetings during COVID-19 have been really helpful to comms teams. That's a good point there. So Michaela, leadership often leans on communications teams to support in a variety of ways. Are there any things communications teams can do to be at the ready to help leaders? Anything comes to mind that helps facilitate a positive and collaborative relationship?
Yeah, so I think it's such a good question, because when leadership calls on communications, and I know I've done this in the past, and I'm sure there's a knee-jerk reaction to just take whatever they're asking for, run with it, get it done, and present it in a timely manner. But one of the, if you have good leadership, one of the things they'll probably be very self-aware of is the fact that communications might not be their area of expertise, and that's why they're coming to you. And so I think it's important to ask as many questions as possible and try to really understand what it is they're looking for, what their goals are. Because while they, oftentimes someone will say, hey, can we do a news release for this? Or can we, create a social media campaign for this? But when you really dig down and find out what their goals are, that might not make sense for this project. So I think it's important to make sure, and communications professionals are not unfamiliar with this, in that, you have to have as much information as possible before you provide a recommendation or analyze the situation well enough to know how to move forward. And I think leadership knows that. And I think oftentimes we don't necessarily take the step back, take a breath, and try and understand exactly what leadership is trying to accomplish here. We just want to please them. So we want to go and do whatever we're assigned right away. But I think just taking a pause and asking a few questions might shine a light on something that maybe leadership themselves wasn't even fully aware of. So I think that the main thing there is just ask as many questions as possible.
That's a good point. I'm just sharing that as well now. So when you have that asking the questions, for any newer comms professionals here on the call today, if you don't kind of get the information you want, or it's not helpful, or it's not, how you said you have to have as much information as possible, but what something that you've done, or that you can shed some light on, to kind of because sometimes I have asked questions and I'm like, okay, this is great, and I get the information back. I'm like, this is actually not that helpful. It's not going to be enough information to craft a message, for example. And I'm sure many communicators have been at their computer, like, how am I going to make this into 2 paragraphs, and give valuable information to whomever, patients or staff or whatever. Do you have any tips on any ideas on that? Like, what us as communicators can do? How can we probe more, or ways we can not get around, but to make it happen?
Yeah. I think, having a good team around you, and I know this isn't really a piece of advice because you can't always control the team around you, but having a team around you who you can lean on for support and bounce ideas off of is really key. Because I've been with the Ottawa Hospital for just under 4 years, but there are people on my team who have been there a lot longer. And if I run something by them, chances are they've run into this situation before. So pulling on your team, turning to your team for advice is very crucial, because you never know what they've seen and how they can help you kind of answer this question, or solve this problem of not having enough information. Maybe it's someone else that they recommend you contact. Maybe it's, oh, I've worked on this project before, I actually have some information on that. I think having a really good team around you is step number one. And then really, probing more and trying to get more information wherever possible is always an option, but leadership is busy and they don't always have time to sit down with you. So sometimes I would recommend, asking them who you can speak to. Like, once you've talked to whoever it is on your leadership team and you feel like you've gotten pretty much all the information you're going to get from them, ask them, okay, is there anybody else who you recommend I speak to, just to make sure I have all the information? And delegating is something that leadership is very good at. So they will probably recommend someone on their team, or someone on, in your organization, who might have a little more time to sit down and really dig deep on the information here.
No, that's very valid, very good points. So communicating with employees is critical to the overall success of an organization. We talked about a lot today already. Do you have any tips on what's worked well, and even perhaps a lesson learned when communicating with employees?
Yeah. So obviously internal communications for healthcare organizations has been crucial this year. It always is, but during a global pandemic, making sure your staff have all the information they need is vital, to not only them doing their job, but keeping themselves safe in a situation like this. Right. And I'll speak to healthcare organizations and hospitals specifically. I don't know that this is the case for other organizations, but at the Ottawa Hospital, we have a staff of well over 15,000 people. So our internal communications is bigger than some companies' external communications. So internal communications is crucial. And the other thing that we have at hospitals that other organizations might not have is a huge portion of our staff who don't use email, who very rarely check their email, because they're nurses or they're doctors or they're frontline workers whose job in their 12-hour shift is to care for patients, and they don't sit at a computer. So using technology, digital communication and email in particular, isn't always the most effective way of reaching them. So what we've done is we try to arm managers and leaders with as much information as possible to have face-to-face conversations with staff to make sure that they're getting the information they need to help them do their job. So this might be at bedside meetings, at shift transfer, at rounds, whatever touch points staff already have with their leaders. We've done our part to arm the leaders with as much information as possible, whether it's key messages, scripts, what have you, to make sure that they're able to answer questions from staff, but also give staff the information they need. And that's really where the bulk of our internal communications is the most effective, is when we can reach staff face to face. Because like I said, not everyone uses email. When there's more broad internal communications that need to happen, we've turned to this year virtual town halls, where we might have like a Teams or a Zoom call with a couple people, be it from leadership or elsewhere in the organization, who are sharing important information, taking questions, and not speaking face to face, because it really isn't face to face. It's more of a presentation, but presenting this information in somewhat of a different way where staff don't have to read an email about it. And the beauty of virtual town halls is, staff can tune in live, or they can watch at a later time when it suits them, right? Be it, after their shift, before their shift, what have you. So really it's about meeting staff where they are and understanding that one form of communication is never going to be enough. Even with the smallest of organizations, one form of communication is never going to be enough, and making sure that that information is available in as many different places as possible really goes a long way.
And have you ever found that over communicating does, I know we always say repetition is what gets the people, but have you found that, or any instances where you've over communicated that it turns people off, employees, especially obviously when we're talking about talkative employees?
Yeah, that's where email really bogs us down, I think, because on the small occasions or the short occasions where staff do have time to check their email, if they see, if they start reading an email and they see something that they've already seen before, they're probably going to tune it out, right? Healthcare professionals are very, very good at determining what they need to pay attention to and what they've already heard before, because they know they only have so much time and bandwidth and brain power in a day, and they're very efficient with using it. So I think over communication is often a risk, and that's where the face-to-face communication, I think, really comes in handy, because it's more of an open dialogue with, hey, what information do you have? What information do you need? What questions do you have for me? It's not just, here is the latest information. It's more of a two-way conversation.
No, that's great. So storytelling is at the core for any communications team. And we know you're very passionate about it. So how has it helped you and your team and lifted any of your outputs that you've done?
Yeah, so storytelling is really central to most of what we do at the hospital in terms of how we get out important information. I like to frame any kind of announcement we have around a story. So, it's always important to know what people want to read about, what people want to hear, and how you can kind of frame your information within that structure. So an example I'll use is this was specifically pertaining to SEO, search engine optimization. We had a new set of concussion guidelines that we were supposed to announce. So, in any other year, the headline may have been new concussion guidelines to diagnose concussions. And in some cases, that's fine. But we wanted to take a bit of a different approach with this. So we did some SEO research, and we found that one of the most common things searched for was around concussions was symptoms of a concussion. So we wrote an article about how to recognize the symptoms of concussion and optimize the article in terms of the content of it, the alt text and images, the tags, the headline, the summary, all that stuff. We made sure it was optimized for symptoms of a concussion. We wrote an article about that. And then within that article, presented these new guidelines as part of it. New guidelines to diagnose a concussion, it very naturally fits into this topic. So people aren't going to tune it out. but they're more likely to land on this when they search for concussions. And it ended up being one of the most popular articles on our website because of the search engine optimization that we had incorporated there. And therefore, I would argue it's a much more effective way of us getting this information out, because we're getting people to land on this page who are looking for this. SEO is all about value and what you provide, what kind of value you provide to the reader. And if you don't provide value, if the article is not what they were looking for, they're going to turn away, and the SEO isn't going to work. But if it is valuable to them and it has content that they were actually looking for, they're going to stay on it, and they're going to read it, and they're going to get that message. And it's ultimately going to be a more effective way of communicating. And I know that there's a lot out there about, organic content versus paid content, but when you're working with a healthcare budget, sometimes paid content isn't an option. And SEO is a really, I think, effective tool for working around that a little bit and giving you the best chance to make sure people are finding your content. So that's kind of one way that we use storytelling. Another way is
there anything, sorry to interrupt you, is there anything that I have this article up, is there anything that people can recognize here, like see now, that you did to get that, to drive the article and drive the content?
Absolutely. So you'll notice that the 4 words, symptoms of a concussion, are in the headline. They're in the summary, which is just below the photo. And they're in the first 100 words of the article as well. And then, you can optimize, you can use subheads. So you'll see what is a concussion. You can use alt text in the images, which is more on the background and on the back end. You can use photo descriptions, just making sure that those keywords are, and also mainly concussion, but symptoms of a concussion being the most effective, are throughout the article in these different spots. And there's a lot of information on the internet, where you can find, best practices, recommendations for SEO, where to make sure the content is located, and really how to do this. There's a lot of helpful information out there in terms of optimizing content for search.
Excellent.
Any other questions on that one?
No, keep going. I interrupted you.
Oh, no, that's important. So the other kind of area of storytelling that we've tried to focus on is multimedia. Podcasts are huge right now. I don't think I need to tell any of you that. So a couple years ago, we started On Call, the Ottawa Hospital podcast. And initially, it was actually a way of reaching our internal audiences because, like I said, a lot of our staff don't check their email. So we thought, well, why not give them content that they can listen to on their way to work or on their break or whatever, but presenting them with the information that we would have been sending them in email. It then kind of shifted over into more of an external storytelling medium. And really what we've tried to do here is use the fact that, we're a healthcare organization. We have experts in a variety of health topics. Let's use them to present information in a population health kind of area. So you can see how to maintain your mental health during COVID-19, a very popular topic that people are searching for. Sometimes it's interviews. We announced a new CEO this year. So we used our podcast as a way to introduce him to the public. We've used this as a way to talk about popular healthcare topics, popular health topics, using some of the experts who we have kind of at our disposal, so to speak, in the hospital. And then the other area, and you'll see one of our podcast episodes is actually focused on this, but using social media for an open discussion has been something that we've tried to do more and more this year. And that was mainly through our Healthy Conversation series, which started as discussions about racism in healthcare. So a number of our staff would take over our social media for an hour and answer questions from the public about their experiences of racism in healthcare. Our staff would share their experiences and just have an open dialogue about some of the tougher topics in healthcare that we don't often discuss. And now it's kind of shifted. We've opened the Healthy Conversation series up to a much more wide variety of topics, but focus on marginalized groups. So you'll see our most recent discussion was about people living with disabilities. So we had a panel of people with disabilities who would talk about their experiences. They all work for the Ottawa Hospital, and they would talk about their experiences as a staff member, as a patient, and what people can learn to ensure that we're creating a more inclusive space. And the key here is, because it's on Facebook Live, we're taking questions from the audience and we're engaging in our audience a little bit more that way. So it's less about presenting information and more about having a conversation. And that's pretty much the main bits from my storytelling experience.
Steve has a question here. Says, thanks for a great session, Michaela. I'd be interested in hearing about a situation where you had to do a correct the record sort of action with a reporter or columnist who has aired. Any instances on that, or tips and advice?
Yeah, so this is where the relationship building really comes in handy, because it's never an easy conversation. And I guess it depends on what you're correcting. Sometimes it's something as simple as the name. Sometimes it's something much more serious and has more specific implications of the story or of the reporter. So, I think having a good relationship with the reporter to start with is very important, because then when you do come to them and you say, hey, listen, this is actually not correct. Can I get you to correct it? It makes them taking that information a lot easier. But other than that, I think, the main advice is just be very clear about what was incorrect and what is correct. And the other thing I guess I would say is know when to, know how to pick your battles a little bit with that one. Sometimes, we have very small things go wrong in articles here and there, where it's a naming convention or something like that. I don't often bog down on that. Where I do want to correct reporters is when the information that they're presenting is giving false information to the public, or setting expectations in the public that could be harmful. And I think just framing it that way, framing it as it's important that the public knows this because it's going to help them do, X, Y, Z, that ultimately that's kind of the common ground you have with the reporter, where their reputation is based on them presenting accurate information and making sure the public trusts them. So if you present it in a way that, like, the information you have right now is inaccurate and it's going to cause a trust issue, they're very receptive to that.
That's great. Are there any other questions that people have want to speak up, and you can ask them anytime? While we wait, I did have a question for you. As we kind of enter we've already entered phase 2 of this pandemic, is there anything that you're noticing that people, like either it could be employees, it could be leadership, it could be patients and families, that they don't want to see anymore, that you're noticing no traction, like we shouldn't do any more of X or Y or this?
That's a good question. I think staff in particular, healthcare workers they've been stretched thin all year, and I think that they're becoming fatigued, and some of the messaging, it was very easy to pick up on some of the messaging that they were becoming fatigued on. And a lot of that was the healthcare hero message, which healthcare workers are heroes, and I just want to put that on the record. But they don't, sometimes saying you're a hero can actually cause more damage, because it sets unrealistic expectations in themselves of what, it's okay that they're not feeling great. It's okay that they're exhausted. What's important is that healthcare organizations provide them with the support they need, which is what the hospital has really focused on doing.
Yeah.
Versus just praising them, which obviously, that is still important, but it's the backing up of the praise. I think we've had to shift our messaging a little bit there.
Totally. I can totally speak about that. We interviewed someone by the name of Crystal Mack. She works at Providence Care near Kingston, and she mentioned how healthcare heroes, actually, she doesn't like it because she finds that it's in a moment of time, and she's like, we're technically, healthcare workers are heroes all the time, not just because it's pandemic time. And I was like, oh yeah, I never thought of it that way. There's lots of I'm going to go through the 3 questions here, a few questions because our time is running, and then you pick and you can answer in short form, or we could also do it after. Carrie asked, if you do a Facebook Live, are you prepared for the media joining into that kind of conversation and taking over the session?
Yeah, that's a great question. So we do prepare for, it is open to the public, media may join. So we do run through some of the tougher questions if they do pop up, but we also set the expectation of, if we don't get to your question now, we'll answer it later in the comments, because sometimes it's unfair that participants may be caught off guard, and we want to make sure that we can go back later and answer questions, which covers that quite a bit.
Okay, good. How do you use your intranet to engage staff from Ulane?
Yeah, so we do have an intranet. We obviously make sure that any information that we share internally through email or newsletters lives on our intranet. So if someone misses it in email, they can always find it on intranet. And our intranet is kind of a catch-all for the information where we house it. So it's easier to update that way. Especially in the early days of the pandemic, we had a lot of FAQs for COVID-19, and having them housed there where we could continuously update them in real time. That's our main use of intranet.
Yeah, we can take one more question before we go. I'll have to head back to the main room. Is from Kristen. Thanks for all the great information. For organizations who are more conservative with their social media use and hesitant to use social media to really engage with their stakeholders, do you have any recommendations for getting buy-in from management leadership and using social media as an engagement tool?
Oh wow, I wish we had a little bit more time, because I feel like I could talk about that forever. It is true. Healthcare is very much an area that is often more conservative on social media. I think you look at some of what public health is doing. Ottawa Public Health is a prime example of using social media to A, get important information across, but B, having fun while doing it, and making sure people are engaged. I think the way to get buy-in, and again, like these things are going to work differently with different organizations and different leadership, but presenting them with examples and tangible results of those examples is often how you're going to get leadership buy-in. They want to see statistics, they want to see results, not always likes and shares, but efficacy of communications. And if you show them examples of places where this has worked and where reputation has been maintained of that organization, I feel like they're probably going to be more susceptible to that, but it will take time.
Excellent. So we went over time, but we had so much information, Michaela. Thank you so much for all your insight today. Really appreciate it.